Bismillahirrahmanirrahim. I'm Dr. Abdul Rahman and we are learning ECG. In this video, I will discuss about the blood supply of the heart, and this video is just the continuation of the previous one. And in this one, I will discuss the same blood supply but in a different plane, and to give you an idea about the same thing which we have discussed earlier. So again, let me take you to the whiteboard. In previous one, we have established a few things, that we know that right coronary artery supplies to the right atrium, right ventricle, posterior wall, posterior septum, inferior wall. These were the structures supplied by the right coronary artery. Then left anterior descending, anterior septum, anterior wall, and apex of the heart. Okay, and then the last one, left circumflex artery, supplies to the lateral wall, which include left atrium and left ventricle. That's it. So in this video, let me show the same blood supply in a different perspective. So we are looking at the heart, we are standing at the foot end of a patient, and we are looking at a heart, just a cut section of the heart by standing at the foot end of the patient. So how will we see it? So this is the view which we will be getting. This is right ventricle, this is left ventricle, this is anterior, this is posterior or inferior, this is lateral, and this is, we will say, septal, because it is toward the septum. So now we will apply the same thing, this portion here, and we will see that how it works. So we know that in case of RCA, let's label RCA with the red color. RCA will supply to the all of the right ventricle, okay, and posterior portion of the septum, posterior portion of the septum, and posterior and inferior wall. So this area will be supplied by RCA, right coronary artery, in the red. Okay, left coronary artery, sorry, left anterior descending artery, it will supply to the anterior portion of the septum, anterior 2/3, you get my point, and anterior wall. And apex, which we are not looking in this plane, we are at the midway of the apex and the base of the heart. So left anterior descending supplies to the anterior 2/3 of the septum and an anterior wall. So this blue color is left anterior descending. And let's take green color for this portion, and we have only one portion left, that is called the lateral border of the heart, and that will be supplied by left circumflex artery. So why I showed you this picture? Just to give you an idea about the same blood supply in a different view. Plus, during echocardiography, we know that we have different views in the echocardiography, and the view which I showed you, it is the short axis view. And in short axis view, what we see, the contractility of the heart overall. If any portion of the wall is not contracting properly, then we can imagine, we can assume that this area is damaged, and this area is damaged because that particular artery is damaged, whether it is RCA or left circumflex artery or left anterior descending, if that specific portion of the wall is not moving. So this is also important, but this video is not related to any echocardiography. This is related to the ECG. So just to have an idea, to reaffirm that thing. And now let me show you the septal thing again. Let's take this septum separately. So for example, we have this septum. This is anterior portion and this is posterior portion, and here is the apex, and this is the base of the heart. Base means superiorly near the aorta. Okay, so what is the division? The anterior half is totally supplied by left anterior descending, plus apex is totally supplied by left anterior descending. So only upper 2/3 of the posterior portion of the septum is supplied by right coronary artery. Okay, so just to give an idea about the septum in another view. Okay, because what I thought that in the previous video it was not clear that which area is supplied by the LAD and which is supplied by the RCA. So that's it. This is I think the blood supply is finished. Yeah, this is it for this video, and let's move further.